Did you notice if she did anything to make you feel more comfortable or establish rapport?
I guess her introduction of herself and her specialty, sort of describing her practice, I think that was helpful.
I have found that when I myself, as a human being, as a Black woman, have gone into spaces, gone into appointments myself, telehealth appointments, and the person on the other end, for example, may be white or different than me in some way, and they don't identify those things, I am going to be more cautious with the information that I share. I want to know you, how I can help and support you. We're in this together. We're in this interaction together.
So then you're saying one of the first tips to establish rapport would be to not only share how you identify, but to invite people to tell you how they identify and what's important to them?
Absolutely. Absolutely.
We first establish, is this a good time for the visit? Where they are at that moment. Make sure that they're still comfortable with the format. I think it's also helpful to ask, who else is listening in on the call, because we can't always see who else might be in the room.
Even prior to the provider seeing the patient, making sure that each person in the office actually touches that patient.
Try to schedule the patient with the provider that's seen them the most. Let's say you don't speak fluently in English, you're just going to get by with your visit and say, yes, everything's okay, even though some things are not. And in my culture, we don't talk about periods. We don't talk about sex. We don't talk about, a baby just comes. We don't know how it happens.